Steve Moran here with Senior Living Foresight. We're obviously in this huge, tough, chaotic time with the COVID-19 pandemic. I kept hearing stories about Phil Fogg and Marquis and some really unique things they were doing. And so I reached out to see if we could do an interview, and here we are. So Phil, let's start a little bit by you talking about Marquis, and then let's jump into some of these stories.
Yeah, I think the thing that may make us a little bit unique is we're a very diversified organization, and yet we've integrated all of our different services. And so we're really divided into three business lines. One is Marquis, which is skilled assisted living, some independent, some memory care, and home health care. And then our second is age right care management services. And underneath that, we have an ISNP, a provider-owned ISNP. We do all of our physician and NP services are in that division. And then we have a post-acute care network that interacts and negotiates contracts with our Medicare Advantage payers. Our third division is our business-to-business. We're an ancillary services entity. We have pharmacy, rehab, and a business intelligence data analytics solution called Copilot. And that brand is Consonis Healthcare.
And you have, you've done some really unique things to sort of connect your residents. You call it Vital?
Virtually Vital.
Virtually Vital, and, there we go.
Yeah,
sorry about that.
Yeah, no, that's all right. We, I mean, we've just, right out of the gate, there were some things that we really focused on with this pandemic outbreak. And one of them was when admission or when visitation was restricted, we had to figure out how to keep our residents connected to the community. We started this Facebook and social media initiative where we really encouraged the community, our staff, families, to post anything that our resident population would find interesting. And I mean, we've had thousands of posts, and it's anything from kids singing or people doing acting gigs to, I think I mentioned my son's father-in-law is a paratroopist in Hood River, Oregon, and he's basically doing video montages on the blossoming of the pear orchard. And frankly, I find it fascinating, but I know the residents love it too.
Well, it's sort of like when you're probably sure you've seen these pictures where they have these webcams on golden eagles, right? And you sit there watching them. Oftentimes, you're just watching eggs and parents coming in, and it's the same thing. You just don't want to hang up because you're afraid you're going to miss something.
That's right. That's right. Now we're also doing some of the more traditional things with accommodating Zoom meetings with families and FaceTime and face-to-face through windows or distanced family visits. So we'll basically do anything the family wants us to do as long as it meets within our guidelines.
So the other story I would really like to, so first thing is I'd love to get some examples of some of the videos and pictures that people are posting. If you've got somebody in your team who can say these are like just perfect, that would be outstanding. The second thing is you went to extraordinary lengths to get PPE pretty early in this, right? Can you talk to me about that?
Yeah, you know, when I think about this journey, I think of it as starting in the first week of March. So I think of us as 8 weeks into the journey. You know, our team realized very early that we were going to be judged by the adequacy and quantity of our PPE supply. And we very quickly also figured out that the traditional supply chain was decimated by what happened in China. And we had to get creative. And so we just started doing everything, chasing everything down. And I don't know that we were any different than other providers. I think we just started a couple of weeks before. But between relationships with our existing supply chain, finding new suppliers, and being willing to go to Mexico and take risks, maybe something wasn't quite right, which we did. We sent a plane to Mexico to go pick up standard masks. You know, we just knew, and I think now that we've had just this amazing supply of PPE, it's enabled us to expand the utilization and, you know, really help our staff feel not only protected at work, but we're even letting them take stuff home now to help them be protected with their family members as well.
And then you've also got a comedian you're working with.
That's a part of the Virtually Vital
Okay.
initiative. We have a local comedian. Every year we raise money for Alzheimer's, and we have a night of a comedy. And one of the gals that's been a mainstay in that initiative, Wendy, posts, and she herself is in the 70s. I won't age her or date her, but she's hilarious, and she's been able to connect and provide perspective with some humor, and I think it's been awesome.
So, what lessons can you share that you've learned? Anything you do differently looking back on it?
You know, the first phase of this was just responding to the crisis, and it was dealing with all of the CMS and CDC and state health authority guidelines, executive orders, everything we were dealing with. It's like every single day, our team was sending out policy changes, to the entire company. And so being adaptive was critical during that time. With those came a myriad of human resources, HR issues that we had to deal with. And again, there was no playbook for these things. So you had to solve these problems, and they were all new problems. The PPE was certainly the third probably piece of that was a big part of our response. And then that resident communication. Now, we talked about how we keep our residents engaged. The more critical thing to us was, how do you even communicate? Do you have a case in the facility? Updates. And so we had to figure out this text system, emergency texting system, that we then link to websites, and we had individual websites for each facility, and then company-wide websites. And so anyway, that first 5 to 6 weeks was just responding, and there wasn't a lot that we would have done different. One of them would be that PPE supply chain took a little bit to get, and if I could go back in time, I would have had an emergency medical supply. I don't think there'll be a provider again that won't have an emergency medical supply of PPE in case we ever face this again. The other is at the home office. I think I would have started restricting visitation and doing some other things sooner. But beyond that, I think we feel pretty good about it.
That's cool. So do you see this relaxing? Are we in this long new normal of being kind of where you're at? Because it sounds like you feel like you're pretty comfortably stable for where we're at right now.
Yeah, like I said, we responded to the crisis, and now you've got to figure out, what is, not to overuse this term, but what's your new normals? And by that, for us, it means we've taken large occupancy reductions in the facility, especially high post-acute care facilities, because the hospitals have emptied out their occupancy to accommodate any potential surges. Well, in most market areas, you haven't seen those surges, and in those market areas, you've got empty hospitals and dwindling, short-term stay occupancy in the SNFs. And so we have to figure out where that is going to bottom out, in terms of when does your census hit its low, and then how do those admissions come back? That's the biggest economic impact that we've seen, and that's what we're trying to navigate through.
And your all buildings are all Oregon, or Oregon and Washington?
Oregon, California, and Nevada.
Okay. And are you any place where you're being forced to take residents with active COVID-19 cases?
From time to time in this journey, especially in the beginning, hospital health systems would put a lot of pressure on us to take positive COVIDs. Now, we had one facility that we had some positive COVID patients in. We were able to contain it within about 10 days. And we would take somebody that we discharged back. Thank goodness our residents are stable. But we would take somebody back. But beyond that, we had made a decision that we would not do that. I want you to know, though, that in Oregon specifically, we just last week had a kind of a big roundtable of all the hospital association leaders, the health systems, the skilled nursing facility providers, and the state, to try to really begin working on how do we plan around a phased ending of restrictions, and what does that look like? And I will say I'm very proud. In Oregon, it's been a very collaborative initiative, and I think that we're going to get to collaborative protocols that will help us gain confidence. And things like you got to have a negative test result before you accept a resident or a patient into your facility, and maybe another test within 3 to 4 days. Because at this point, with all the restricted admissions, the risk that we have our staff who have gone home and brought it back in, or new admissions.
Are you having trouble getting testing?
Yeah, it's very, very situational. For example, in a market like Portland, Oregon, we've got all the tests that we need, and we've got the health systems, again, very collaborative with getting 24-hour lab results back. And then you'll get into rural communities, and they just don't have the same access to the testing equipment, nor necessarily the capabilities of getting that turnaround. I would tell you that testing now is going to, and how we test is going to be the real critical piece that needs to get solved. It's a challenging question because even if you test 100% of your staff and residents on a Monday, that's one point in time. And if that makes sense to you, because Wednesday somebody could have brought it in, and so we've kind of gotten around the philosophy that we would test 100% if you got a positive code in your facility, just so you knew the extent of the problem. How big is it? At a certain point, the buildings in America that have had outbreaks, you just presume that that it's a positive COVID if signs and symptoms are demonstrated. So what I'm looking for is the rapid test results. If the day that we can get a test that, sorry about that, I just got a call come in. The day that we can get a test result within 10 minutes or even 2 hours in the facility location is the day that you can start looking at daily 100% testing.
Yeah. I mean, you start wondering if it's going to be, I don't know, better analogy, but like having to go through TSA, that you've got to go through this screening every time anybody walks in and out. Which sounds so burdensome, but I guess with TSA, we've sort of just gotten used to that being part of the process. And maybe we'll get vaccines. I don't know.
Yeah. I think hopefully there'd be a cure first and then a vaccine. But again, very aggressive utilization of PPE is the real answer. If you knew your population was free, and didn't have any positive COVID, at that point, it's that PPE utilization that is, I think, personally, where the best investment is.
So are you doing other things for your team members besides the PPE, which clearly is the most important because it gives a sense of security that you just don't have if you don't have the PPE?
Well, we're really blessed in our organization with a lot of long-term great leaders. And I think we've seen over and over again that leadership is the key to this, and having leaders who can keep people motivated and keep them positive and keep them focused on our mission is really the key. And again, our team has just been able to thrive. And I have to tell you, there's been so much negative media out there, and unfortunately, the focus of those articles, principally in the print media, are kind of those worst case scenarios. And the facts are that if you walk through any of our facilities, it's amazingly quiet. It's because people aren't visiting. The residents are, generally in their room, and it's just an incredibly quiet, peaceful environment. It's not panic. It's not chaos. Now, I'm not saying that none of those situations exist where you've got massive outbreaks, but I believe those are the minority, and I believe the majority of the facilities are really solid and 10 times more quiet than a normal day and before COVID.
Yeah, it's really hard for me because you know, even when you look at sort of the most inflammatory statistics, most senior living communities, both skilled and assisted living and independent living, are COVID free. And even with those buildings that have had cases of COVID, most of them have been able to do a nice job of containing it and protecting residents and staff and family. And the challenge is those stories are just not getting told. And, you know, trying to figure out where, as we look at telling the story, you know, I lay a lot of this blame, frankly, at the feet of the government for not providing adequate reimbursement, really even normal times, and not really focusing on PPE for the post-acute world. But I think we have to be honest and say that there were some operators who didn't probably stay on top of this the way they should have. And as an industry, we should be willing to talk about all of that. And because when people like you are doing it right, that needs to be celebrated, and that contrast needs to be there, I think. So.
Yeah, I generally agree with you. I think that PPE scenario was the perfect storm. You know, we're trying to consume it all. The manufacturing facilities stop at the same time. So I think that the PPE thing, I don't know that anyone's to blame, but it was our reality. I think that the spots where you see the hot spots, it's not just long-term care facilities that have a hot spot, it's the general community. Unfortunately, a death in a hospital is a stat. A death in a skilled nursing facility or assisted living facility is a news story for some reason. And
yeah, I mean, a lot more people have died in acute hospitals from COVID-19 than have died in senior living. And nobody's coming out and screaming, well, we better do something about the hospitals.
And you don't see the stats on a daily basis. You know, one thing I will say, though, when you talk about the government is, first, Seema Verma has been an absolute rock star. I cannot tell you how appreciative I am of her and her efforts and her team's efforts. They, from the very get-go, have made their absolute best efforts to be an asset to our profession, and with supplies, with the guidances. They've tried to be collaborative. Trying to ease unnecessary rules and regulations during this, you know, time. The state and counties have struggled a little bit more. You know, I just think it's inherent to when you have states with, you know, 15 to 40 counties, you got a whole bunch of different leaders who are doing it differently, and they seem to have been the environment where we've had a little bit more challenge. But CMS and Seema Verma have killed it.
Man, I'm really glad. I'm so glad to hear that, because, you know, I've heard a number of stories where buildings have been in the middle of just this horrible crisis to have the state regulatory people come in and just, you know, start doing inspections and citing them and issuing fines, and that's pretty discouraging to me. And it's got to be just devastating if you're operating a community. So.
And imagine if you're in a positive COVID building where you're dealing with this terrible situation. Now you got media and you've got regulatory pressures. And I don't know very many leaders or very many environments that have had to withstand that kind of pressure and or could withstand that kind of pressure.
Yeah, I agree. I've talked to a couple of operators where they've made the decision to essentially test everybody. And ultimately, it's been the right thing operationally for them to do, but it's brought down the regulators, because then in a couple of cases, they've had a lot of people, both residents and team members, test positive, though not necessarily being symptomatic. But then they've had to report that, and of course, these big, huge numbers of positive tests come out and it makes them look bad when they really did the right thing. And you don't know in other buildings where it might be the same way, and they chose not to test, probably ultimately to the detriment of the population. So,
yep, I agree.
You know, but we got to figure this stuff out. I'm feeling a bit encouraged, because I feel like we're starting to see at least some voices in the press who are saying, wait a minute, we need to take a hard look at why this happened in nursing homes and not just pounce on them. So yeah, I think we're going to come to the other side.
And I think American Healthcare Association is really engaged. You know, again, you got to defend everybody in this process. That first 4 to 6 week period is just you're responding, right? You're just reacting to everything that you're dealing with. And so it was unfortunate that the media was one of those variables that had to be managed along the way instead of just being able to focus on the health and welfare of the people that we're serving.
Yeah, that's right. And I look at what happened in Kirkland, which is, sort of up in your neck of the woods. And it's so easy from the outside to look at them and say, terrible company, terrible building. But you know what? They faced something that nobody had ever had to face before. And people were trying to figure it out and do the best they can. And I think we've got to, we need some grace in all of this.
I say this often, actually. The regional for life care is a friend of mine, and they're a good provider. They've had good quality results. And the unfortunate part of that whole scenario, and I've actually said it to him myself, is their crisis, their situation became the rallying cry for all of us. And I basically say that they gave us 2 weeks of lead time to prepare. If we wouldn't have had that situation to see what their reality was, what they were going through, it would have put us behind the 8 ball at the same time. And so while what happened there was tragic and very sad, I don't know of another provider who didn't look at that and go, holy cow, we got to take action right now.
That's right. That's right. Yeah, no, I think that, again, as you say, good provider, good organization. The building was a 5-star building. And so I think that they've been very unfairly maligned because the press just jumped on it. And you're right. I mean, they were the canary in the coal mine. And likely what happened there ultimately saved thousands of lives because it was this early warning to get there.
Exactly. I think that's accurate. I think you could say it literally saved thousands of lives. I think that's a very accurate statement.
Yeah. So, Phil, this has been terrific. I appreciate what you're doing, and so appreciate the time.
Yeah, thank you. I've enjoyed the time as well. Thank you.
Great.